everyone. Here we are showing the method of bladder method for ultrasound. We want to make sure we put gel on both sides of the bladder. And we use the bladder for irregular areas that maybe the skin is maybe taut, like around the Achilles tendon, or maybe thin, maybe around the lateral ankle where there's a bony prominence we need to conform around. And there's a couple methods that we can use. We can use a commercial bladder, which is pictured. We can also use something maybe like a balloon, a plastic bag filled with gel, or we can use something kind of outside the box or normal thinking like a breast implant or condom. We can fill those with gel so that the ultrasound travels through, but a condom would definitely be more affordable and disposable. A breast implant would not be necessarily disposable, and those may be hard to get into the clinic. You'd have to have some connections with maybe some plastic surgeons in the area, but those are definitely options that you can use. Make sure that you wipe away any air bubbles as you are applying the treatment. And if you see some show up on the sound head, make sure you take care of those. We are selecting a 3.3 megahertz. Probably would want to switch that to a 1 megahertz because that would be deeper. And we want to make sure we increase the watts per centimeter squared a little bit higher than normal, because we do have to fight through that thick bladder. Also keep that in mind when you're choosing your frequency. If you're adding a bladder, you got to account for the thickness of the bladder and having the sound head fight through that. So we're keeping good contact with the bladder and the sound head. We're not tilting. We're moving 4 centimeters per second at a size that's 2 to 3 times the size of the sound head. That should about do it for the bladder method. Make sure again that those air pockets are not showing up. Make sure you wipe away any bubbles that you see forming underneath the sound head.